widely more helpful. And again, as I mentioned before, this supports early detection, which is essentially critical for improving cancer outcomes. The AI is then able to help personalize cancer treatment, essentially by analyzing tumor characteristics and the patient data. And with oncology, actually AI supports treatment planning even further by essentially identifying which therapies may or may not be the most effective. In this case, with treatment planning, it's not able to go in such depth due to ethical considerations. Right now, it's still very in its early stage, but it's able to provide some sort of personalized planning, at least at the first stage level. With AI models, they can analyze responses to treatment over time, and they can even detect early signs of resistance. So with the treatment planning, it's, of course, with some treatment planning with cancer, essentially the resistance level can be very high. So with these AI models, it's able to detect for the patient as to how the resistance is high and what can be done about it. And again, this is also at the very early stage. And in some settings, AI can even help predict side effects and tolerance to specific therapies. And really, this allows clinicians to adjust treatment strategies earlier rather than waiting for the disease progression. So now I want to go into AI in cardiology. So cardiology essentially generates high-volume physiological data that is just really difficult to interpret manually. So with AI, it's widely used to analyze ECGs, otherwise known as electrocardiograms. And basically, they're able to detect abnormal heart rhythms. And in this case, really, the machine learning models are then easily able to help identify these early signs of conditions, right, such as arrhythmias or heart failure. And even though this is at the early stage, it's still able to identify at least stage 1 of these types of conditions. And even though it's able to detect such an early stage, with this, the clinicians are then able to come up with a decent treatment plan as to how they can, essentially use AI to monitor heart rate, variability, and activity patterns for wearable devices. Currently in Stanford, there is something known as a bond-wear bandage, where essentially the patient it is a tech bandage, right? So there are AI models inside this bandage, where essentially when the patient puts on this bandage, the AI is able to essentially analyze the blood vessels that's going on, especially within the wound, and able to determine how vast the injury is, and it's able to go as far as to say, what is the heart rate based off of how injured this person is, what is their stress level, and depending on the activity that they're doing, how is this affecting the wound. So that is a current wearable device that has already been built in Stanford. However, due to ethical considerations, it's not widely popular as of right now, as there are many skeptics about this wearable device. So as time goes on, the goal is that hopefully more people are able to trust wearable devices for healthcare, especially for wound care. So that way it's able to, we're really able to track how, essentially how good we can get this treatment to people. So longitudinal tracking allows clinicians to really detect changes earlier rather than waiting for acute signals. So this is referring to when we're able to see how long, right, whether it's over a couple of weeks, to detect whether it changes, let's say if it's changes in your heart rate or changes in your activity patterns. We're really trying to see why, or where I should say, those acute events are happening, and exactly why are they happening in the first place and what to do about them. And the AI will even suggest treatment suggestions to really help with that as well. Another thing is artificial intelligence also assists cardiologists by prioritizing high-risk cases and it supports clinical decision-making. And so then overall, the AI helps shift cardiological care from reactive treatment to then preventive monitoring. So now I want to go into the mental health side of AI. So mental health being one of the biggest cases in the healthcare industry today. Right. In this case, we want to figure out how can really AI help with mental health. And of course, as you can probably imagine, there's a lot of ethical considerations to think about when it comes to mental health. As in, Can AI really replace psychologists? Well, that's why it's been kind of a debate in this, right? When you look up ChatGPT and you ask if you have a certain problem, ChatGPT is then able to kind of just give you a baseline summary of how to solve it, maybe give you some breathing exercises, which is essentially what the psychologists slash psychiatrists can do today. That being said, it's still not to the level of where we need it to be. So this is where I'm going to talk about what it can be done. So right now, the AI tools, as I mentioned, they're increasingly used to support screening and early identification of mental health concerns. So for example, in the case of diagnosing someone with depression or anxiety, that's where these AI tools will come into place. Of course, it won't full on say that this individual has depression or anxiety, but instead it will say that this person is at risk for depression or anxiety, and here are the following treatment plans to essentially help this person. Another thing is natural language-based AI can really analyze speech and text patterns related to mood and stress, right? So in this case, if the user is, or even the patient, I should say, is presenting fast speech patterns or slow speech patterns, or even if their text seems to be off, the AI is able to analyze that, and it's able to then correspond to how high or low the mood is for the patient and how stressful that patient is as well. Another thing the AI can do is it can also help track changes in sleep, activity, and emotional regulation over time. So this is where essentially, in the model itself, it's able to see those patterns of how good you're sleeping or how poor you're sleeping, what is your activity level, are you happy most of the time, are you sad most of the time. It's really able to check those patterns, and it's able to come up with a personalized report that can then be sent to your clinician or even your psychologist in this case as to where you lie in terms of your mental health, and then the clinician slash psychologist is able to determine what treatment plan is best based off of that.
So my proposed solution. So we will present here by images to recognize the structure using my custom training model. I found some data sets, images, and each after detecting all the content image.
I couldn't really hear that well. Whoever is speaking, if they're able to paste into the chat what they said, that would be great. All right, so I'll continue on. So in this case, as I mentioned, continuing on here for AI-powered tools, it's then able to increase access to support between clinical visits. And importantly, what we really want to focus on here is that AI should not replace these therapists or clinicians, but it should instead provide additional insight and monitoring. And then, of course, when designed ethically, AI can then help reduce barriers to mental health care. So now I want to go into women's health specifically. So with AI tools here, when it comes to women's health, it's first able to analyze menstrual cycle data, which then identifies patterns in its mood, sleep, and energy and focus. So this is really essential when it comes to the menstrual cycle. And when it comes to AI tools for that, it's really able to detect on a large data set, right, essentially for women, where they are in their mood, their sleep, and their energy. And it's able to detect within that week, or essentially during whatever phase that they're going through in their menstrual cycle, it's able to detect, essentially what is going on, and really figuring out what kind of plans that can really help the woman in distress, and see what can be done to help with their clinician, to see what better treatment plans, if any treatment plans are necessary, or if better, more natural remedies need to be taken in place. So these systems really help capture changes that are really often missed during short clinical visits, and especially when it comes to fertility and reproductive health. AI supports ovulation prediction and hormone trend analysis. So in this case with the model, it's again able to track those patterns, right? As along with machine learning here, it's really able to detect those patterns over time, and it's able to see where, especially for ovulation prediction, it's able to see either when it's going to come about. It won't give a direct answer. Sometimes it might say, oh, it might come up with this week, it might come up with next week, and here's the trends that might come along with that. So right now, that's where it's at in that current stage. And when it comes to AI models, even more specifically, they learn those individual hormonal rhythms rather than really relying on the overall population. So instead of going based off of, like if I wanted to look at those hormonal rhythms across India, for example. In this case, the AI model is not going to look at through every single state and just kind of see where those hormonal rhythms are. It's really going to learn through a particular sample size. So in this case, if you wanted to predict a particular city, a particular town, it will go through the hospital where they registered those data, and it would really go through each individual's hormonal rhythms rather than relying on essentially the whole data sets. So when it comes to pregnancy and postpartum, in this case, the AI is able to help monitor sleep disruption, stress levels, and it's able to go over any mental health risk factors. And then when it comes to premenopause and menopause, AI is really able to help track cognitive symptoms, essentially such as memory decline changes and brain fog as well. So now I wanted to go into AI and longevity. So what do I mean by longevity? Longevity, I'm essentially talking about how can we better ourselves when it comes to aging, right? As we get older, right? What are some ways that we can essentially not only look younger, but feel younger, right? And that's one of the biggest challenges. And with that, now the new challenge is how can AI essentially help us reverse aging, right? And I don't mean necessarily by some AI chip that we put in ourselves that will help us look younger, but more so, what are some plans or models that it can really use for us to follow to either make us feel younger, look younger, and perhaps even just improving our activities over time to really get us more active. So AI allows really aging to be studied as continuous and individual processes. And in this case, with the longitudinal data, it's really able to help identify early changes in regulation, recovery, and resilience. And when it comes to those AI models, it's really able to learn those personalized baselines instead of relying on the population averages. So as I mentioned before, when it came to women's health, right, instead of relying on the whole population as a whole, it's really looking at those customized, personalized baselines. So that way it's able to come up with a more better treatment plan, essentially where it's able to kind of see where the data lies and kind of really be able to come up with a better solution. So going into specific biomarkers, right? When I mean by biomarkers, I mean, for example, if I wanted to look at someone's metabolism, their sleep patterns, their cognitive data, right, their stress, right, I really want to see how can I track that over time. And with AI, it's really able to see, based on those reports, it's able to give a really good analysis as to what's happening with your biomarkers and what are some suggestions as to essentially how to improve those biomarkers over time. Now again, with AI, it's not going to give a complete diagnosis. It's not really going to say, you have XY disease and you need to cure this based on your aging. Of course, that's not the goal. In this case, it's really only, the goal is really to just suggest what can be done with what you have going on as a patient. And really, what can the clinician and you come up with as a plan to really help improve those biomarkers? So in this case, the AI has been able to help integrate those complex data from multiple sources into a coherent picture, which I will showcase in the next slide. And this approach supports earlier insight rather than late-stage intervention. So in this case, we're really trying to make sure that instead of just a quote-unquote, right, prevention is better than cure. So in this case, we really want AI to be able to follow that same quote as well. We're making sure that we're able to see what are those earlier insights that we can figure out for the patient rather than waiting until it's too late, whatever stage that they're at, and trying to solve whatever either disease or biomarker that they're dealing with. And in this case, overall, the AI has been able to analyze really just a more personalized and data-driven understanding of what it really means to be aging healthy. So here I'm going to talk about the AI Longevity Portal. So as Matt introduced, that I'm part of the R42 Institute. So in this case, we are currently working on a AI Longevity Portal. So in this case, this is what I've built so far. For security and privacy reasons, I can't showcase the entire portal, but I can at least show you the landing page, which is what you're seeing right now. And in this case, what the goal is, we want to make sure that we get at least over hundreds of thousands of patients being able to record their own data, their own biosets, their biomarker set data essentially. Let's say if you wanted to get an MRI scan, really not only what's going on, but even some suggestions as to what can be improved. Suggestions, it might give some supplement categories. Now again, I have put to try to uncover here, which is creating this portal. So for me, when I started this portal, I spoke to a couple of neuroscientists and some longevity scientists, and they all agreed that this portal should be displayed at a longevity retreat, which is what will be happening, I believe, next year on the 16th of January. So actually in a month, I should say. So in this case, they will showcase this portal on my behalf. Unfortunately, I cannot attend. It is only for those that are ages 40 and up. So I will have someone to represent what I've built here as to that where the patients are then able to put in their tests and have it be analyzed by the AI model. So in this case, that's where the AI is going to try to really advance itself in. Now, of course, there are some debates as to that. Let's say it's too late and you're at the late stage. There are some that say that AI will get to the point where it can also help at the late stage. Again, this is up for debate. But if that is the case, then that is definitely something to look forward to, of course. But I think, I think most of us can agree that finding something that's more of a prevention treatment is definitely better than finding something that's at a very late stage. So in this case, right, we're going to continue to monitor one's health with AI and really just more clinical visits will be taking place, especially with AI being involved, right? We have to consider how ethically this is. We have to consider how accurate the AI is when it comes to these health monitoring systems. Especially when it comes to accuracy, that is really the most important I guess that's really the most important thing here, right, for assessing risk for various conditions. So we want to really make sure that it's just highly accurate and also making sure that the clinicians agree with what the AI is saying and how the analysis works. Eventually, we also want the AI system to really help individuals just understand their own health patterns over time. So again, when we go back to the portal in this case, where you're able to upload your own health data and you're able to see how that looks like over time. Essentially, the idea is you're able to then upload multiple health data results. So for example, if I were to go get an MRI scan today right now, and if I were to upload those results into this portal, but let's say if I wanted to come back 6 months later and upload another MRI scan and it's showing something different, in this case the portal should then be able to analyze those two different tests, one that I took now versus 6 months later, and it should be able to compare what's going on for both of those and whether 6 months from now if my MRI scan has improved or whether it's worsened. In the case of when it's worsened, let's just say that it is, it won't exactly tell me that, oh, your MRI scan has just become terrible and you need to go see a doctor right away. It'll be a little bit more soft-spoken about it. It'll kind of be like, so your MRI scan, it shows this and this, maybe some supplements might be needed here, maybe some longevity focuses might need to be taken care of here, and so this is something that you should see a clinician about. So that's really how we want it to be worded. So going back into cognitive health support, right, which is we really want to make sure that it gets expanded beyond traditional clinical settings. And we also really want to make sure that AI will really help with managing growing healthcare complexity and really just reduce clinician workload. So we really want to make sure as we go into the future for healthcare that really the clinicians, they shouldn't have to work so hard in terms of analyzing all these huge data sets for all these patients, right? We really want to make sure that the clinicians are really providing the best treatment plan at the most efficient rate as possible. And we really want to make sure that the AI is able to get to the point where it can analyze over thousands of health data sets reports and making sure that it provides the most accurate analysis reports and making sure that it provides a decent treatment plan that both the patient, the clinician, and of course the AI can all agree on. So I want to talk about the ethical considerations here for AI in healthcare, right? As I mentioned before, we want to make sure that it's ethically considered here for every type of treatment plan that is being prepared by the AI, or perhaps even just the analysis that is being done. So we want to make sure that the AI systems are designed with strong safeguards, really to prevent sort of this misuse or unauthorized access. We want to make sure that it's very secure and it's for authorized users only, especially for the longevity portal as I just showed. And patients should just really understand how their data is collected and used and essentially analyzed by these AI models. Now, of course, we want to make sure that transparency is really just essential so users just really know when AI is involved in these healthcare decisions. And when it comes to these healthcare decisions, we want to make sure that, as I mentioned before, that AI doesn't provide the exact decision, right? It provides something more of a plan, more of a basic analysis where the clinician is then able to say, okay, based on the AI model of what it's telling me, this is what I think so and so should happen. So again, with ethical AI, it requires clear boundaries, as I mentioned before, around what AI and AI cannot do. And with AI, it should be able to support clinicians and patients and not really replace human judgment. And when it comes to the training data, I'm sure as Rajesh mentioned in his presentation, right, we really want to make sure that it's trained properly. And when it comes to this bias in training data, we want to make sure that it doesn't lead to really this unequal or unfair healthcare outcomes. So we want to make sure that it's equal and it's fair across all outcomes here. And when it comes to responsible AI design, we want to make sure that that requires diverse and representative data. So when we're going into looking at different ethnicity populations, I should say, we want to make sure that the AI is understanding of that and understanding that with certain ethnicities, there might be certain environmental changes in terms of how they were brought up. So the AI should be able to understand that based on those environmental upbringings for various individuals, how that affects their health, and it should be able to analyze a proper plan and also agree with the clinician as to where the health data sets align. In this case, the AI systems should also be evaluated continuously as real-world conditions change, right? So as we get more into various other diseases that come about, especially with COVID that just came about, in 2020, as we all know. In this case, with the shock of COVID, really, even though AI was still existed in 2020, however, with the shock of COVID, it wasn't quite analyzed in such depth. Now, if you were to look up, for example, AI analysis with COVID, you would see so many different data sets and analysis being pulled up right now as we speak as to what are some possible treatment plans, some preventative measures. At least that's what the AI can come up with. So as we look forward into that, let's say if, for example, the next wave of COVID were to hit and if it was something stronger than back in 2020. In this case, we have various companies, for example, one company known as NeuroAge, where they are looking into essentially, when it comes to these next wave of diseases, really figuring out where can AI kind of just help stand in them and really come up with the models that will help go into any preventive measures. So really the future of AI in healthcare just depends on aligning with technology, with these human values, and just really ethically human-centered AI is just essential for long-term trust and adoption. So lastly, I just want to go into some of the free resources that I believe would be helpful if you really want to go into AI in healthcare. So a couple of them here. So there's one for AI for Everyone by Andrew Midge. He's on Coursera, and it's for free to audit. So it's really just a non-technical course. So if you don't want to go into the AI tools in such depth, but you want to get a basic understanding, that's where I would take this course, and he would just kind of go into some machine learning concepts, deep learning concepts, and really just how real-world AI is used in healthcare. Another one that I really like is Elements of AI, provided by the University of Helsinki, and it's really just a globalized course, just focusing on these AI concepts and really figuring out how they impact society. And it goes into a little bit about the healthcare side of it as well, but I think it would definitely help in terms of really just understanding how AI is applied in the society aspect. So again, as Matt mentioned before, I'm also affiliated with Stanford. So of course, two of these resources will be Stanford affiliated. One of them being the Human-Centered AI, so HAI. And in this case, they provide free articles and YouTube talks on AI applications, ethics, as well as healthcare use cases. And another one is the Stanford AI Index report. That's a free PDF that is accessible. And it's just really an annual report summarizing essentially where AI is going into the healthcare ethics side of things. And it also talks about just really about where the trends of where the healthcare space is going into, right? So as I mentioned about AI in cancer care, AI in cardiology care, it really talks about where that's going. And essentially, there's also even like I believe there's like a debate conversation sort of comment section that is, I believe it's on another page, where essentially there are people just kind of debating, if this is the right idea where AI is heading, and what can be done about it. And then the other two resources, so this one is MIT, J Clinic. So I'm also affiliated with a professor from MIT. He and I are working on a project together, and he was the one that suggested this resource, which again, a free resource on YouTube, where it's just they're just basically going over some talks about really how is AI going into healthcare and how is it going to cancer care and clinical settings, just go more in depth. And then the last resource is a Google Health AI blog, and that's just really just some articles just explaining some of these AI models, as I mentioned, but even more in depth and just really going into how they are being applied into the healthcare setting. All right, so that is all for my presentation. So since there's 15 minutes left, I will leave it up for any questions, comments, suggestions. I believe there's someone that said something, but I couldn't quite hear them. So if that person would like to speak up or put in the chat, or if anyone else has any questions or comments, please feel free.
Ma'am, I have one doubt, ma'am.
Yes, go for it.
What impact will AI have on improving overall healthcare efficiency, ma'am?
Improving overall health, what was that?
What impact will AI have on improving overall healthcare efficiency?
Current efficiency. Oh, okay. So essentially, what AI will do is it won't go into such an impact as of right now, but it's able to give a pretty good analysis as to how the current efficiency will be displayed later on. So right now, it's able to provide that analysis right now. But it's something that's still being talked about, actually. Even next week, I have that conversation with another professor about that. So that's still up for discussion. But we do think that it will get pretty advanced within the next 5 years. So there should be some talks that will be discussed about that as well.
Thank you.
Mm-hmm. Okay, and if there are no more questions, I will drop my email in the chat. So if anyone wants to reach out to me personally for any questions, or if they have any. Yes, I have a question from Dr. Narayanan. He says, are these models used in any hospitals or clinics? That's a very good question. So right now for these models, they are currently used in more so in research hospitals. So for example, like in the Stanford Hospital, it's being used there, but not so much in non-research hospitals. So right now it's more so with postdocs that are really using these models. But again, these are all at a very early stage. So right now they are not used that extensively. At the base level stage, they are being used for just the basic, just for basic analyzing some data, but not to the extent of where we want it to be. But that is the goal, essentially, to be able to use these models in various other hospitals and clinics. No problem. All right, and if that's all the questions, I was just dropping my email. Oh, there's a comment over, it says, over-reliance on AI for diagnostic decisions may result in misdiagnosed or inappropriate treatments. Yes, that is actually very true. So that is why it's very important that the clinician is still very involved with the AI, right? That's why, as I mentioned before, we don't want AI to replace essentially any of these healthcare workers, or as VP CLC says, right, essentially that if we rely on AI too much, then it will result in those misdiagnoses. So we really want to make sure that the AI works hand in hand with the clinician. So whatever the AI says, essentially the clinician should be able to see how accurate that is, and the clinician should really make the final judgment at the end of the day. So that is currently the goal. Of course, there is some debate as to whether maybe within the next 10 years, maybe it might get to the point where an AI could make a whole diagnosis, but for right now, we really want to make sure that the AI works hand in hand with the current condition. Thank you for that comment, though. So I just dropped in the chat my email, so for those that want to reach out for any questions, suggestions, please feel free to do so. Yeah. And I think that should be it. Oh, how about pharmaceutical companies? Yeah, so with pharmaceutical companies, there are some, it's actually kind of a limitation right now for AI modeling. For the specific one that I'm working on a project with, there are some baseline models that are being used, really just to analyze some of those drug developments and really figuring out, right, where those baselines can be. But for right now, it's at a very limited stage. Even as we go further into these pharmaceutical companies and with these AI models, it should be getting more advanced as it gets later on, but for right now, they're at a very baseline level. No problem. Okay, in that case, I just want to say thank you to Rajapalayam Women's College for letting me be here today. On behalf of Equity, I'm really grateful to be able to present this presentation, and I hope everyone here has learned a little bit something about AI in healthcare. And again, please feel free to check out those resources, as I mentioned before, or even just email me if you want those resources again or any questions. Thank you.
Thank you, ma'am. Shall we conclude the meeting, ma'am?
Yes.
I would like to welcome Ms. Sahana, second BSc Computer Science, to deliver a word of thanks. I extend my sincere thanks to Principal Ma'am, guests, faculty member, and all participants for their valuable insights. Thank you, ma'am.
Thank you.